Angelina Jolie underwent a removal of both of her breasts, both of her ovaries, and fallopian tubes because she had a BRCA1 gene mutation. Now, a BRCA1 gene mutation is a defect or an abnormality in the genes that significantly increases a person's risk of developing breast cancer, ovarian cancer, and pancreatic cancer. And that was why she did that, right? Now, this mutation or this defect in the gene is something that can be passed down from a parent to their child, that's their offspring. And it's very important. The reason I'm saying this is as a woman or a man, if you have a very strong family history of cancers, right? Someone in your family, especially a first degree relative, so a sibling or a parent, or even sometimes a cousin or grandparent has had breast cancer, just multiple cancers, breast cancer, ovarian cancer, pancreatic cancer, prostate cancer in the family line, you need to be seeing your doctor, your GP. If you have a direct access, if you live in a country where you have a direct access to a genetic specialist, you could refer yourself to a genetic specialist and get a genetic testing done, because you want to find out whether you have a gene mutation, an abnormal gene that significantly increases your risk of developing cancers. Now, women and even men who have BRCA1 or even BRCA2 gene mutations can develop breast cancer at a much earlier age, and those breast cancers could be more aggressive. Now, in men, BRCA1 and even BRCA2 gene mutations increase the risk of a man developing prostate cancer at an earlier age. So it's very important that both men and women who have significant family history of cancers get a genetic testing done. If you're unsure as to whether you have a significant family history, speak with your doctor. We usually assess and find out who and who in your family line have had cancers, and then decide if it's actually worth referring you to have a genetic testing done.